Good day. I'm Dr. Kester again, and now I'm going to talk about a topic of how COVID-19 affects our body. Actually, this is the latest findings. And number 2, who are at risk? So there are many articles saying that COVID-19 causes strokes in the young. So we look at different articles. Here is number 1 articles, your COVID-19 cases, strokes in young. Number 2, the young and the middle age barely sick with COVID-19 dying of strokes. Number 3, CNN News, sudden strokes in young adult, doctor says. Looking at it, there is a big possibility that COVID-19 is not totally a respiratory virus disease, as we all know it, that it only affects the elderly population. In fact, it also affects the young, and here's why. As we all know it, that when SARS-CoV-2 virus enters our nose, mouth, and lungs, it will enter to the type 2 pneumocytes of our alveoli, entering the ACE2 receptors of the alveolar cells, from there causing replications and damage to the cell. And we have these following symptoms. From there is cough, eventually shortness of breath, then ARDS, acute respiratory distress syndrome. Or it may lodge to the throat, causing sore throat, or it may lodge at the back of the nose, causes loss of smell. We call that anosmia. So, however, new findings reveal that SARS-CoV-2 is not plainly respiratory in nature, but it is also an endothelial disease, a blood vessel disease. So note, the ACE2 is one of the many receptors on the endothelium of the blood vessels. So once SARS-CoV-2 gain entry into the lungs, then it can travel to the blood vessels attaching to the ACE2 receptors of the endothelium, causing the following events. So look at this diagram, the renin-angiotensin system, wherein the liver produces angiotensinogen. Then angiotensinogen will be converted to angiotensin 1 via your renin. And angiotensin 1 will be converted to angiotensin 2 via your angiotensin converting enzyme, your ACE. So we will focus on angiotensin 2 because angiotensin 2 plays a critical role in the infection of SARS-CoV-2 virus. So angiotensin 2 plays a critical role in the pathophysiological modulation of cardiovascular function. It's also a potent stimulator of NADPH oxidase. We will discuss this further about NADPH, which is the major source and primary trigger for reactive oxygen species. And here, number 3, critical component of renin-angiotensin system, RAS, for the regulation of blood pressure and cardiovascular homeostasis. So angiotensin 2, under normal condition, will be converted to angiotensin 1,7. This is a very good stuff for human body because this angiotensin 1,7 is very protective. It decreases the blood pressure, it decreases clot formation, and it decreases inflammation. So all the good stuff in maintaining cardiac homeostasis. And angiotensin 1,7 is also the opposite or the antagonist of angiotensin 2. Just remember, when angiotensin 2 produces angiotensin 1,7, when it's more angiotensin 1,7, it's more protective. When it's less protective. So angiotensin 7 is responsible for endothelial homeostasis, wherein disruption of angiotensin 1,7 will cause oxidative stress. Now, if SARS-CoV-2 infects the ACE2 receptor, this will happen. From angiotensin, normally, it will be converted to angiotensin 1,7, but not anymore because the SARS-CoV-2 virus occupies that receptor. Therefore, angiotensin 2 is unopposed. So, angiotensin 2 is increased. Angiotensin 1,7 is decreased. Therefore, there is increase in blood pressure. There is vasoconstriction. It can cause pulmonary edema and cause acute respiratory distress syndrome and clot formation. And here, oxidative stress. We're going to talk about oxidative stress. So oxidative stress means there is an imbalance between the production of your reactive oxygen species and the lacking or decrease of antioxidants. Here you have a chart wherein you need oxygen and then you need an enzyme called NADPH oxidase to convert it to superoxides. Then superoxides, when oxidized, it will produce hydrogen peroxides. And hydrogen peroxides, when oxidized, it will produce hydroxyl radical and eventually to produce water. Take note, NADPH oxidase is the enzyme produced by your angiotensin II. And it is mitigated or antagonized by your angiotensin 1,7. So if you have a lot of NADPH oxidase, your angiotensin 1,7 is the one that will antagonize the effect of your NADPH oxidase. And remember, angiotensin 2 is the one that produces angiotensin 1,7 via your ACE2 enzyme. So when your ACE2 enzyme is being infected by your SARS-CoV-2 virus, ACE2 enzyme will be knocked out. So therefore, there will be no production of angiotensin 1,7 and there will be nothing to antagonize NADPH oxidase. Therefore, your reactive oxygen species, collectively known as your superoxide, hydrogen peroxide, and hydroxyl radical, will reign supreme. And then, reactive oxygen species are counteracts by your antioxidants. Antioxidants are namely your superoxide dismutase and your glutathione peroxidases and your catalases. These systems countercheck the balance of free radicals. Now, so oxidative stress, so these are the increase in reactive oxygen species, will cause stimulation of the von Willebrand factor in the subendothelial, and then it will couple with the factor 8 in the endothelium to produce thrombosis, hypoxemia, blood vessels constriction, stroke, and the ground glass appearance of the chest X-ray. You need to increase your antioxidants in order to counteract the free radicals or the reactive oxygen species. So you can take multivitamins in the form of copper, zinc, and manganese. So with increased antioxidants, at least you can keep in check those reactive oxygen species. Here is a table of people or a population with pre-existing abnormal elevation of factor 8. These people has increase in factor 8 to start with. So these are diabetics, the pregnants, advanced age, inflammatory conditions, if you're obesity, if there is liver damage, cancers, kidney diseases, cardiovascular diseases, and smoking. So remember the table that we see about the oxidative stress. First, it initiates von Willebrand factor, and then it initiates your factor 8. So it increases factor 8, producing reactive oxygen species. Now these people has comorbidity already. And these people, these populations, has already a pre-existing abnormal elevation of factor 8. So you imagine what will happen if these people are infected with the SARS-CoV-2 virus. And there will be a very high chance of having thrombosis, stroke, and cardiovascular events that could happen. So we may be looking at a wrong perspective from the start, which the virus only infects the lung. Well, it does infect the lung. However, the infection does not end there. So it's probably using the lung for it to gain entry and for it to travel to the endothelium and do endothelial damage. So this could explain many reasons why people get strokes in the young. This may explain why your blood is hypercoagulable. This could explain dermatological conditions of patients having COVID-19. This could explain out of control thrombosis. This could explain the patients having critical condition with severe hypoxemia, even their lungs is still okay. So now we can summarize what's happened. Okay, when you breathe in the SARS-CoV-2 virus, it enters the lung. Then attached to the ACE2 receptor of the lung, then using the receptor of the lung to gain entry to the endothelium of the blood vessels, causing inflammation of the endothelium, causing the release of reactive oxygen species, causing unopposed angiotensin II, feeling the effects of angiotensin II, decreased production of angiotensin 1,7 because of ACE2 is knocked out by the virus, increased release of NADPH oxidase by angiotensin II, causing stimulation of the von Willebrand factor, then coupled with factor 8, and remember the group of people with high factor 8 will cause thrombosis, stroke, cardiovascular events, and dermatologic conditions. And here, we answer the number 2 question, who are affected? So these people, shown in this graph, are affected, young and old. So these people are at risk of having thromboembolic phenomenon because these people, to start with, has very high factor 8. So in my personal opinion, these free radicals are the one that cause possible of cytokine storm of patients. And what I see, that this COVID-19 disease is not only a respiratory disease, it's not only an endothelial disease, but for me, COVID-19 is also a social disease, and it's also a lifestyle disease. You imagine our life, we cannot go through our normal process, and we should be 1 meter apart each other. So socially, it's already psychological taxing. And lifestyle disease, I think this COVID-19, for me, hates people that are unhealthy. Like people has diabetes or obesity, so I think this is a lifestyle disease. So if you want to learn more about COVID-19, please stay tuned for the next video. And thank you for watching. And don't forget to give a thumbs up and click the subscribe button. And if you have any questions regarding COVID-19, please feel free to comment down below and I will try my best to answer it for you. Thank you.